September is National PCOS Awareness Month, otherwise known as Polycystic Ovarian Syndrome. It's a hormonal disorder that can cause infertility in some women, affecting about 6 to 10% of premenopausal women. And joining me is Megan Robinson and Fertility Institute of Hawaii's Dr. John Fratarelli. Aloha to you both.
Aloha.
Hello.
Now, Megan, you were diagnosed with PCOS. Kind of tell us about your journey through that.
Sure. So I was diagnosed with PCOS in 2015, and I had never heard of Polycystic Ovarian Syndrome. So the first thing that I did was I used social media to reach out to women, and I said, does anyone have this? Can you help me understand what this means? Right. And I was very surprised at the number of messages privately on Facebook that I received of women saying, Megan, I have it, it's okay, we've still been able to have a baby. I got a lot of reassurance through that, and then I delved into researching. I wanted to know, what does this mean for me? Does it mean that I'm going to have problems getting pregnant? But what I did realize is that so many women are affected with PCOS, and it is still possible to be able to have a child. So I wanted to prepare myself with the information so I knew exactly what I needed to do to be successful. And in order to have a baby, yes, that was the plan.
You have beautiful baby Easton now.
Yes, I do, I do.
That's great. Well, Dr. Fratarelli, how would someone even know that they have this, or is it you have to go to the doctor and find out?
Most patients do not know. Most patients come in and they get the diagnosis when they're sitting in front of us. Some women are savvy enough in that they have friends or family members who may have had the diagnosis, and they think that they may have some of the same features. They'll have irregular menstrual cycles, they'll have some acne or some abnormal hair growth. But some of the findings that we find with PCOS, like the abnormal hormone levels, you're only going to get if we draw blood. A bunch of follicles on the ovaries is another diagnostic feature. You're only going to get that if we do an ultrasound and we can see it in the office.
Okay, and so how do you treat this?
Treatment really varies depending on what the patient's wanting. So they're really I talk about two different avenues. If someone's trying to get pregnant versus someone who's not trying to get pregnant. If you're not trying to get pregnant, really what you're doing is you're treating the symptoms. So typically the first line therapy is birth control pills, because patients are oftentimes having irregular menstrual cycles. So you want to get their regular cycles to be regular, and so you use birth control pills, and that will help decrease a lot of the symptoms that patients will have. But one of the basic things I think everyone should always start with is really exercise and diet. A lot of times it is a way that if patients, especially patients who are a little bit obese or a little bit overweight, if they can lose a little bit of weight, that will help with their PCOS symptoms. Even patients who are normal weight and thin, a little bit of exercise, if they're not exercising regularly, can help with that.
Okay, Dr. Fratarelli, thank you so much, and Megan as well. We'll have more information on our website, hinowdaily.com.
This segment is sponsored by Fertility Institute of Hawaii.